Hello, this is Siddharth Damber from Chicago Arthritis, and today I want to talk about hip arthritis. So I've had two interesting cases recently regarding hip joint pain, and I think it gives a sense of the flavor of what can be involved in these kind of cases. So the first case is my father, and the second is another patient of mine who I've known for a while. So what we've come to realize over the last few years is that hip joint arthritis is a more challenging joint to treat and arthritic condition to treat than, let's say, knee arthritis. And there's likely a biologic reason for this. Namely that there was a study that came out a couple years ago that looked at early hip arthritis patients and found that the patients that were more likely to progress were individuals that had evidence of mesenchymal cell dysfunction within the bone around the hip joint. Basically evidence that there's a biologic problem going on with mesenchymal stem cells that could cause the progression of hip joint arthritis. So if you have hip pain, it's worthwhile getting evaluated sooner rather than later, because if you do have a hip joint issue, it's better to get treated more aggressively sooner rather than waiting longer as it progresses. Now, the reality is that hip pain can be due to a number of different things, including, besides hip joint arthritis, we're also talking about hip tendonitis, other soft tissue issues around the hip, SI joint related pain or dysfunction, lower back issues, IT band issues. So there's a number of other things that can be causing hip pains that go beyond just hip arthritis. So the first case is my father, who's a 73-year-old marathon runner. He called me up recently saying that he was having hip pain, a little bit of restricted range of motion, and most importantly, he was having difficulty running. So naturally, with my understanding of hip joint arthritis progression, I was concerned about what could be going on in his case. So immediately I tried to evaluate him, look at his imaging, and luckily in his case it turned out that his issues were really more hip tendonitis and SI joint related issues. With basically platelet-rich plasma treatment, he's done great. He's back to running, range of motion is fine, he's had a great outcome. Case number two is of a patient who I've seen and treated for several years for knee arthritis. She's done great in the past for knee pain treatment. For the last 6 months, she's had hip pain that's failed physical therapy, some other kind of conservative measures. Upon evaluation, it turns out she has a moderate degree of hip arthritis as well as early avascular necrosis. So this is something that has to be treated early and aggressively and managed in a more directive and aggressive manner in order to prevent this from progressing and to get her a better outcome. Because realistically, if we wait another 6 months, there's a good likelihood that she's going to be really on a quick path to requiring hip replacement surgery. So in her case, recently she received bone marrow aspirin stem cells to treat both her hip arthritis and her avascular necrosis. And so hopefully over the next 6 to 12 months, she has a good response and hopefully is able to avoid the requirement for surgery. To me, the kind of takeaway points here are, number one, if you have hip pain, get checked out sooner rather than later to figure out what it is and get treated appropriately. And if you do have hip arthritis, to get treated really ASAP to prevent this from progressing. Great. Let me know your thoughts. And until next time, hope you have a great day and live well. Thank you very much. Bye-bye.